So everyone, thank you so much for tuning in to our YouTube channel. As always, I want to try to bring you very clear, high-level descriptions of topics that are oftentimes very confusing and appear to have a lot of in-depth information that really gets super confusing at times. So what I really want to cover at this point is the discussion of ovarian cysts. And ovarian cysts can cause a lot of comorbidity, a lot of pain, a lot of discomfort, and they certainly can cause patients to miss work, miss school, miss active days of their lives just because of the discomfort. And so a lot of times ovarian cysts present in multiple different ways. Something that's significant if you're having abnormal cycles, or if you're having pelvic pain, or if you're having abdominal pain. These are all symptoms, just a few that can be significant for an ovarian cyst. A lot of times the abnormal bleeding and or pelvic pain and abdominal pain are the primary presentations when ovarian cysts are then found, because a lot of times patients don't even know that they're there until they're symptomatic for pain. So it's very important that you have these evaluated, not only to improve your quality of life, but also to get a diagnosis depending upon your age. There's some people that are a higher risk factor for ovarian cancer versus benign findings. And of course, there are multiple different variations of tumors of the ovary, of course, some being benign, some being malignant. So it's very important that you get these evaluated. And again, most people don't know that they just have an ovarian cyst until they're evaluated with a pelvic examination and a pelvic ultrasound. So if you're concerned or have a history of ovarian cysts, or concerned that you may have abdominal pain that you really can't describe, or pelvic pain that you really can't describe very well or understand why it's there, please contact your OBGYN doctor and get this evaluated, because again, with very minimally invasive techniques, you can get a diagnosis. And certainly ovarian cysts can become very high risk clinically relative to a risk of what's called ovarian torsion. And that means that the ovary is actually twisted on its blood supply, and that becomes a surgical emergency. So these are circumstances and disease processes that can be very benign at times, but can also be very aggressive and concerning. So overall, most ovarian cysts can be managed conservatively, but there are some that need to be managed more aggressively to make sure that the patient is healthy and stays safe. So if you have any questions, again, abdominal pain, abnormal bleeding, pelvic pain, symptoms of that nature, please go to your OBGYN and get an evaluation to rule out ovarian cysts. And again, they're oftentimes treated without surgery, and they can be managed very conservatively, and we can help you a great deal with this condition. So if you have any questions, contact your OBGYN and they'll be able to help you. Thank you.